Hi friends, welcome back to my channel. I'm Shuri if you're new, and if you're not new, thank you so much for coming back. As you guys see from the title, today's video is going to be a day in the life of a surgical tech. For those of you who don't know, I've been a surgical tech for almost 4 years now, and I currently work in plastic surgery. So today's we have two cases on the schedule. I have a tummy tuck, which is also known as an abdominoplasty. We have an arm lift and also a thigh lift as well. So I like to go ahead and get started by just putting on my scrub cap and taking off all my jewelry and my watch and get ready for my 5-minute scrub of the day. I typically like to do this before I even go into the OR to start opening supplies and stuff. I like to just go ahead and do the 5-minute scrub and get that out of the way first thing first. So I will go ahead and just open up a scrub pack and then do a quick hand wash with just regular soap, and then go ahead and take the pick and also just go ahead and clean my fingernails. And you always want to do this under running tap water just so it can help flush out whatever is underneath your nails properly. And this is something that you always want to make sure you don't skip this step, because even when you don't think it, there's always stuff underneath your nails. Even when you keep your nails very low and short like I do, there's still stuff always underneath my nails. So I go ahead and start doing my scrub. And like I said, we do a 5-minute scrub every day at the beginning of the day. Some people also do this after lunch. It's definitely a preference thing. And some people like to do this right before they scrub in as well. I typically do not like to go into the OR wet. I think that just causes more problems with me trying to not get water on my sterile supplies and things like that. So I just like to do this first and then use dry sterilium when I'm scrubbing into the case. So after I finish up scrubbing, I'm going to go ahead and go over to the OR. And typically I will set up everything the night before, but this was Monday and I typically don't work on Fridays. So I normally have to like grab all my supplies and stuff on Monday mornings just because I don't do it on like Thursdays. So this is what the room looks like. It's just an abdominoplasty, so I don't open too many things. I just open a pack which has most of what I need, and then I open my instrument tray. And then I go ahead and I set the Bovie to a setting that I know my surgeon likes. He typically goes in with 40-40, a little bit more aggressive for abdominoplasty since we're going to be cutting through a lot of tissue. And once I go ahead and wait for anesthesia, the surgeon to see the patient, I always make sure I get some breakfast, and I always make sure I get some coffee. I didn't always drink a lot of coffee, but I figured now I finally figured out like coffee and like lactose free milk and all that stuff, that now I just always have a cup of coffee before going into a case, and it really helps my energy levels, especially first thing in the morning. I'm usually not a morning person, so I know, weird. I found a job that requires me to be a morning person, but I'm still not a morning person, so I need that cup of coffee. And I also need a really big breakfast because I get really hungry, and when I get hungry, I can't think. So I always make sure I have a nice big breakfast. So today I'm having eggs and some toast, avocado toast. So then I didn't show you guys me setting up because my nurse actually opened for me, and then once I'm open, I typically don't go setting up my table until the patient's in the room, so I don't usually would film that part. So this is just me breaking down my table after the case was over. So after everything's done, I just go ahead, break down the case, take off all my sharps, make sure everything is where it's supposed to be. um, I make sure all my fluids are in one container so that I can go ahead and solidify them. And I just take off whatever I did not use so that I can like reprocess them. Like we try to, when we're a small office, we try to reprocess certain stuff because we also do like local procedures and things like that. So I'll reprocess things, letting it get dirty, like laps or Ratex or towels, and we'll kind of repurpose those around the office because we also do clinical as well and skincare services. So we'll just reprocess stuff so we cut down on like our waste costs. So I'll reprocess certain things that I know did not get touched. So when I'm like doing the case, I try to keep things nice and clean, and I try to like separate things and make sure they don't get all dirty because I know I'm going to like reprocess them in the autoclave. I never reuse them in like a big surgery, just for our skincare and like clinic days, basically, like little locals. So this was for the next case. I would clean the room, turn it over. My nurse cleaned the room. Usually we just like, we have two nurses and I'm the only tech. So one nurse usually does like PACU and pre-op stuff, and then the other nurse will help with circulating and like help me out with like turning over the room and things like that. So she did that, and then I just went ahead and grabbed all the supplies needed for the second case. This was a pretty big case. We had to do a thigh lift, arm lift, and if you guys know anything about thigh and arm lift, these cases are absolutely the most annoying cases to scrub, simply because of the I mean, a thigh lift, the positioning for that is just insane. And I don't know if I told you guys this, I probably did, but I am starting my first assist school. It's very, very soon. So my surgeons are nice enough to, they're going to be my preceptors for my program. So they teach me how to scrub. I'm sorry, they teach me how to suture. What am I saying? They teach me how to suture and things like that. So this case, I was able to close some of the incision, and it was like definitely a big learning curve for me, because learning how to suture in like weird crevices and things like that was definitely difficult. But it was a great learning experience, and I really appreciate my surgeon for giving me the opportunity to do that. But like I said, I will be starting school soon, and I'm going to be doing this, do suturing a lot more, so I want to get as much practice as I can. So I also got like a suture pad so I can practice on my own at home and stuff. But yeah, usually surgical techs do not suture, so don't think that that's something that you're going to be able to do. But like I said, my school is starting soon, and my surgeons are always in the room. They're right there next to me. I'm right under their supervision when I'm suturing, and I'm usually only closing skin incision. So I don't want you guys to think that that's something that you're going to be able to do when you are a surgical tech, because that's not your job. So then I'm setting up for the next case here, and I just kind of open all my supplies. And I feel like sometimes people get confused as to how we open sometimes. I know there's a lot of hospitals that have policies that don't allow you to flip things onto the field. I've always, when I worked at the hospital, that was not even a thing, even when we had lots of people around, because it's not usually like, you can't necessarily use up your nurse's time to like open every single supply for you when you can just do it yourself. You just have to be strategic. And I know it looks like I'm close to the table, but I'm really not. It's just on camera, it looks like I'm really close. I feel like I always have someone yelling at me that I'm too close to the table, but I'm nowhere near the table, you guys. And you have to be strategic in the way that you open things. So like when I'm opening packs like that too, I make sure like I hold it a specific way that my hands are like basically shield on like the back of the packaging, if that makes sense. And so that was pretty much after the case. We ended pretty late this day. We ended at like 5:30, so this was like a 12-hour day for me. And then I just went ahead, turned over the room, and I basically laid out everything that I needed for the next day and just got everything set up. I did not realize the quality right here was so bad, because I think I had a thumbprint, but I was just basically getting everything ready for the case the next day. It just saved me a lot of time. So I I had like 3 cases the next day, so I set out like trash bags and things like that. We were going to be doing a lot of lipo, so I set out the suction canisters and just have everything ready to go, so that once I'm done with one case, I can just quickly turn over things and just be ready to go. But here I'm responsible for cleaning my instruments as well. So when you work in smaller practices, it's probably something that you're gonna have to do, is to turn over your own instruments. So, and I do a lot, so I will go ahead and restock the OR. So that was just me grabbing some extra supplies that we needed for the OR, like suction canisters, anesthesia circuits, and things like that. So yeah, this is me just basically re processing my trays and getting them ready to be reprocessed. So I already cleaned them, and now I'm just putting back the trays together and getting it ready for the autoclave. So as I was explaining, this is something that you will have to learn how to do once you go private, because they typically will not, they're not going to hire someone for sterile processing. Like, that's just something that the tech is going to have to do themselves as well. But it's really not that bad because our trays are really like so small. You guys can see the size of that tray. That's my main tray right there. That's a tray that I open for every case. I have two of those. So it's really not, it's not difficult at all because we don't use like big instruments and things like that. Like, it's plastic surgery, you know, so we don't use a lot. And the one thing about the surgeons that I work with is that they are very, they're not high maintenance. They don't need, they can get by with like the most minimal things. Like, they do not need a lot. So our trays are very small, they're to the point. They just have exactly what's needed, and if they end up needing something else that's not in the tray, then obviously we grab that for them. But there's just not a lot of instruments around for us to be messing around with. And I mean, when I have like days when I have like 2, 3 cases, it's a little tiring after standing there doing all that stuff and then having to clean instruments. That can be a little bit exhausting, but honestly, I just like put my earbuds in and I just listen to music and I get it done because it's just, I gotta get it done. So that's just me wrapping the tray. I always do the diamond form so that it's easy to open, so that when you're opening the packs, you're not touching what's on the inside. And this took me a while to like get a hang of it, but once you do it all the time, like I do this pretty much like every day, so I think by now it's a year later, it's definitely something that I can just do like pretty easy now. But yeah, that's pretty much what my day looks like. After this, I basically clocked out and went home. I didn't get home until like 7 o'clock this day, but it was fine because I only work 32 hours. I don't work on Fridays. And then because I knew I was going to have long days, Wednesdays and Thursday, I actually ended up going home early on Monday. So I think I had one case on Monday. I did that case and then I went home, y'all. I went home at like 1 p.m., no lie. So it's really not that bad. It's not like, it's not every day that I have 12-hour days. So some days we have like no cases at all, and it just is what it is. We do have clinics, so I'll help out on the clinic side, and we do skincare, so I'll help out with that too. I really like my job and I really like where I work at now. And yeah, I hope you guys enjoyed this video. Don't forget to like and subscribe if you're new here. Don't forget to follow me on TikTok as well as Instagram, as I do post weekly updates on surgical tech stuff all the time. But if you guys have any questions, feel free to reach out to me and I'll be more than happy to answer your questions. As always, I will see you guys in my next video. Bye.